Hello, I'm Mary Beth Marsden, and welcome to GBMC's Ask the Oncology Expert. And joining us today is Brandon Costantino, who is the Oncology Support Program Manager of the Oncology Support Services at GBMC. Brandon, thank you so much for being with us.
Absolutely, you're welcome.
This
Thanks for
job that you have sounds huge.
my team has a huge job. Yeah, my job is to make sure they have what they need to get the job done, but they certainly have a big task ahead of them. Yeah.
I mean, it's such a broad term, oncology support services. You know, so many people are dealing with cancer and cancer issues, and it could run the gamut, right? What you do and what your team
Absolutely.
does.
Absolutely. We have social workers who help with psychosocial counseling. We have a financial counselor who helps with the cost of their patients' treatments. We have a patient resource navigator who assists patients and their families with other costs, transportation, things like that. We have a survivorship nurse who works with patients once they're finished with their treatment, or if they have other survivorship questions, sometimes referring them back to social workers if that seems necessary. We have an admin assistant who basically backs up every single person and helps with our event coordination. We have it all, and it's a big job, but my team's great and they do a wonderful job doing it.
Yeah, and I bet you hear from some patients who say that the issues that come with having cancer or getting treatment for cancer, sometimes the treatment itself is not as bad as everything else that comes with it. And that's where you guys jump in.
It is, yeah. Um, Treatment is often not easy. Having cancer before treatment is not easy. Hearing that you have cancer is not easy. There's no there's no easy space within that journey, and so our job is to try and smooth out those rough edges, remove any barriers people feel they have to getting their treatment on time as scheduled. We want to make sure that everybody's able to have the best possible health outcomes, and sometimes that has nothing to do with insurance or what treatment you're getting. It has more to do with what social barriers you may be facing, and that's where we come in.
Yeah, and you know, we're speaking in such general terms, of course, because we're talking about everyone who's dealing in some fashion with cancer and with the oncology department in some way. But every story is so unique and individual, and people react in so many different ways. You have to be really flexible, I think, you can never assume how someone is going to be.
That's absolutely right. You take two women, both 35 years old, both with breast cancer on the right side, both with two children, both married. Their experience and stories are going to be completely different. It may seem on their face that they might be very similar, but you can never assume that. You never know. I mean, look around the room at wherever you're sitting and look at who else is in the room with you. You probably don't know everything that's going on with them behind the scenes. It's the same thing with cancer patients. We don't know their story, where they come from, what their life experiences are, and what they're experiencing currently. The rest of life doesn't stop because you have a cancer diagnosis. People are still asked to pay their bills, pay their mortgages, go to work, whatever it is. And so our job is to try and help people understand how to cope with what their new normal looks like.
We have a lot of questions for you that we've received earlier, as you know, from various
Right?
people who are watching now live, who will be watching down the road. So in some cases they're specific, in some cases we'll kind of speak generally. You touched on this a little bit, but if you could maybe talk about some of the bigger worries, but the question is, what are some worries patients have after their initial diagnosis? And how does OSS, which is the Oncology Support Services, not a government agency, right? How does OSS help in that situation? What are some of the biggest concerns that newly diagnosed individuals have?
I don't know. We could talk about that for the next 3 hours. The biggest concerns often are affordability of what they're facing, the fear of the unknown, and how it's going to affect their families, those that love and care for them. And interestingly, it's oftentimes not about the patient themselves, but more about everyone around them. Um, and so our job is to come in, hear what those concerns are, hear what those fears are, ask some other questions because some people may not know all of their fears or have not thought them all through. And our job is to help in that process. as much as it is to help with the actual issues at hand. And then to go through one by one, take it one step at a time, make the referrals to the correct resources, utilize the resources we have within our own department, and make sure that we communicate with their medical team about what's going on in cases where that's necessary. Some of the biggest things people face are, like I said, affordability of their care, how they're going to get back and forth to all these appointments, who's going to help me manage this schedule, what do I tell my job, how much of this is my insurance going to cover, which are not always questions we have answers to right away, but they're always questions that we can provide some level of assistance with.
You talked a lot about the various team members that you have. Can you just talk about how your staff works? I mean, do they take an individual? Do you meet regularly about one particular case? And then how do you all connect on so many different levels?
Well, I'll start by bragging about my team and just saying they're very, very good at what they do. The answer to that question, I suppose, is maybe irritating, because the answer is it really depends upon the patient and what their needs are. So we talked about how individualized these stories can be, how often we meet with a patient, how often we discuss their issues, how often we just say hi and, how are you holding up, is really all dependent upon the patient's expressed level of need with us, or just how often they want to stop by and talk to us if we haven't scheduled an appointment with them. So sometimes people are coming to a different part of the hospital and we don't know that necessarily. They're not oncology related and they want to swing by and say hi to their social worker or ask a few questions. And so we always want to be available for that. Some people meet every time they come in for a treatment. Some people will call ahead and say, hey, I'd like to talk to you at this specific treatment. And we won't necessarily meet with them if they don't want to at other treatments. And some people will just walk right through our doors and come find who they're looking for and start talking and say hi. We have patients that have been mostly out of treatment for 5, 6, 7, 8, 9, 10 years that pop in and want to see their social worker, want to see the survivorship nurse, want to see their admin assistant, the navigator, whomever they connected with and made felt like they formed a strong relationship with. And we're always so excited to see anyone that comes in those scenarios. And then for patients who are going through active treatment and are in need of a lot of assistance, we'll see them as often or as infrequently as they prefer, or as we feel is necessary to provide the assistance that we know they need.
And how, as someone just has written, how do you determine who qualifies for these services?
Anyone qualifies for them by saying they need them. Number one. Number two, it's by referral from any place we can find it. It could be a nurse, it could be a doctor, it could be a medical assistant, it could be an admin assistant from a different department, it could be a rad tech. Anyone who interacts with a patient, an infusion nurse, and says, hey, I think this patient really needs to see you, and they'll make a referral to us and they'll send the patient our way. They'll ask us to call the patient, get permission from the patient for us to call, and we'll call and we'll assess what their needs are. And, we can't help everybody with everything. Unfortunately, we'd certainly love to be able to do that. But for the things that we are able to assist with that are within the scope of what we're capable of handling, we'll take it on. And so there's no qualification other than, so if we're referring to an outside organization for financial assistance, for instance, those organizations will have qualifications that need to be met, and we'll screen people for those, ask the questions we know we need to ask, and try to make sure that we're referring to an appropriate resource.
Love that. Come to us. We're here for you. Can you tell us about the boutique that is located at GBMC and what is offered there and how does that benefit patients?
Absolutely. So the boutique is on the third floor of the Cancer Center, and we offer a lot of really wonderful things to cancer patients, including, and I think this is a really neat thing, a $5 private head shaves for patients who we know are going to lose their hair. So you don't have to go to a hair cutter or Great Clips and sit down in public and have your head shaved. Obviously not a concern I have, but we don't want patients necessarily to have to deal with that in public. So we offer that $5 private. We schedule that. We have prosthesis fitting. Our manager of the boutique is a certified prosthesis fitter. We have wigs and wig styling. The other person that works there is a professional cosmetologist, and she will fit wigs, style them. And so patients right above where they get the floor above from where they get their treatment can walk up and get these services.
Do your services apply only to the patients, or can family members utilize your services as well?
Well, so the patients aren't the only ones going through cancer treatment, right? The families are also. So there are services that are specific to patients, but generally speaking, we're here to support the entire family, caregivers, whatever that caregiver is. When I say family, I mean it could be your best friend, it could be a distant cousin that you're very close with, it could be your neighbor that just helps take care of you. Whatever your caregiver, loved one, family is to you, we're here to support you and your support system as the patient.
How do services like massage and acupuncture benefit a cancer patient?
Well, I'm neither a massage therapist nor an acupuncturist, so I will answer in a general sense, which is that we utilize those services for a variety of symptom management. So it could be pain, it could be issues with salivary glands for head and neck cancer patients. My understanding is that acupuncture can help with that. It could be just a little self care. Going to get an oncology massage. We do refer to people who are specialized in oncology massage to make sure that they're not going to interfere with the patient's lymphatic system or anything like that. And sometimes it's just to get a minute, a break from all the treatments, the transportation, the back and forth, and the poking and the prodding that some patients deal with, and just relax. And sometimes it's to relieve a pain in the shoulder or lower back, or wherever, whatever the symptom is that we feel is appropriate for those two services.
I get the sense that you and your team are probably constantly thinking, what can we do outside the box? What is needed that we're missing? What new thing is available that could help other people? Is this a constant effort?
It is. It's actually one of my favorite parts of my job is when I get to sit with my team and brainstorm what we can do to assist a patient with this particular need. Sometimes things come up we haven't experienced before. My team is very experienced. My social workers have been at this hospital for, I think the least amount of time is like 10 years. And I myself have only been here 5 years, but I've been in oncology for 17 years. I think that that wealth of experience, it may seem like new things don't come up. That's completely untrue. First of all, new treatments come out constantly. So we are constantly trying to keep up with what the new regimens are, what the new drug names are, what the programs are that may help with the cost of those, what patients experience when they take those when they're on those treatments. And so we're constantly sort of problem solving, but the people on my team, myself, we really enjoy that process, except for when we can't come up with a solution, and then we really don't like it.
You probably
But
you probably really had to pivot during COVID, didn't you?
I don't know who didn't,
Yeah.
but yeah, we did. We did. You know, that brought a whole new set of challenges to the cancer patient's life, and to the life of the family, especially infection risk, concerns about immune systems being down. I had a personal experience with that, quite frankly. So we all had to pivot. We all had to understand what to do. But the beauty of my team, which I just can't be more proud of, is that they all rolled with it. They all, we talked every day about what the next day was going to bring, what the current day was bringing, what we could do. My team jumped in and helped out with a lot of things that aren't normally on their plate. We ran, ran and got blood from the blood bank at times, and we helped with getting lunches for patients and when volunteers were no longer available to do those things. And I'm very proud of the work they did during that time.
Is there anything in particular that's new or on the horizon that can help you help oncology patients that you're excited about or that you're looking into? That's I can't think of. I don't know, but is there something that particularly you'd love to see come into your program?
Well, it's not new, but not very new. But recently, we were able to utilize Lyft services, which is something that obviously Uber and Lyft have been around for forever, but to help with transportation for our patients. And while it's not new, I think, and it certainly has its own challenges at times, I think it's more cost effective, and it's something that a lot of people have become very used to, those programs. And it's been very helpful for us to be able to get more patients where they need to go. Um, the biggest things that change in oncology rapidly are the treatments. It seems to me there's constantly new treatments coming down. There's clinical trials. We have a wonderful clinical trials department here, and they're always working on new combinations of drugs, even if the drugs aren't new. And so our job in terms of that is really just to keep up with what's going on in that world and understand how that affects the things that we work with on patients on, and make sure that we're prepared properly to handle those situations when they arise.
Brandon, this is a really specific question that just came in. As a GBMC employee, how can I maintain my privacy during cancer treatment, and can OSS help with this?
Oh my goodness. Well, your privacy should be maintained as much as it possibly can be. No one that works with you should be going into your chart. Certainly, if they don't belong there, if they're not an oncology, if they're not part of your care, what it could, people will get oncology care and other care also. But if they're not supposed to be in part of your care, they certainly shouldn't be in your chart. No one should be talking about you coming to the cancer program at all. It's certainly something you could report to my team, a social worker, concerns about it or actual facts. But I would recommend even I, you know, I honestly am a little lost for words on that one, but we'd certainly be trying. We would
Talking
certainly
to
be.
you guys and letting them know what their concerns are would be a first step, right? And seeing where you
Yeah,
go from there.
yes. You can't help it if someone sees you standing in line, or in a waiting room waiting to be seen or treated. But we will certainly do what we can to keep that privacy as much as possible.
It seems to me, and I know that this is a GBMC program, and we're talking with people who work at and love GBMC, but it seems like this program is special.
I
Do you
certainly think so.
do you see it at other hospitals in the same way, or do you feel you're in some ways leading the way in that regard?
Well, we certainly like to feel that we're leading the way. I certainly want to speak poorly of every of other programs. I don't know all hospitals, other programs, but where I have worked at other hospitals, the programs have functioned differently. I think the beauty of oncology support services is they're all housed under one department and all work together. So instead of social work working in one silo, survivorship working over in the clinic, and the navigator working sort of all over the place, which is sort of the model I had at a different hospital. I was the navigator at a different area. Um, Having it all together where everyone can collaborate really creates more of that multidisciplinary approach that we like to utilize here. We're very proud of here in the Cancer Center at GBMC. And being located in the Cancer Center directly as one big program allows us easy access to the physicians, the nurses, the infusion center, the pharmacy, all the other managers that may be able to help us with problems, a scheduling concern because we're worried that we can't get someone in faster or whatever, and we can quickly work with the managers and the team on the other side. Everyone knows everybody in the cancer program, which I think is fantastic. And so the ease of communication and the speed with which we can problem solve, I think, gives us a really big advantage. I don't know if that it gives us advantage over other programs, but it certainly is something I'm very proud of. And I really think the model that we have here is an excellent one.
Brandon, someone who's watching right now would like to know if you could elaborate a little bit more on the transportation services. You mentioned you're trying to utilize Lyft when you can, but are there other supports in that regard?
There are. We utilize some community programs where possible. Certainly if someone is worried about the cost of a ride to treatment, we can help with that. But if someone doesn't have transportation at all, just getting rides to your oncology, while helpful, is not going to help you with everything because your oncology appointments are not the only appointments you're going to be having. You need to get to the grocery store, wherever else you may need to go. So we will utilize county ride, MTA mobility, and some other community programs to help with that because we cannot, unfortunately, give everyone a ride to everywhere all the time. But for patients that are looking we do utilize Lyft now. That's something that started last year. But for someone who's looking for a ride to their treatments, we certainly will talk with them, talk with how many rides we can provide, find out where else we can supplement rides from other areas, and do everything we can to get that person to every single one of their treatments.
Another question that just came in, also very, very specific. Can OSS help arrange genetic testing, such as for the BRCA gene?
Well, we could, but we don't need to. We have a really good clinical genetics program. The physicians can refer the patient straight over there for not just BRCA, but any other genetic testing you may need, Lynch syndrome or Leishman syndrome. There's a bunch, and they'll test for all of that. And we have genetic counselors that will work with patients to explain what their results mean and what things they may need to look out for. So we could help with that, but we really don't need to. If you tell your doctor you think you need it, if your physician says your oncologist feels you need it, then make the referral over to that program directly, and that program will contact you and make an appointment right here at GBMC.
Brandon, how can the community help support what you do?
Well, the obvious answer to that is donate some money. Everything I'm talking about, all these services that we offer, we don't bill a single penny for any of them. The hospital is wonderful to support the program while we don't drive revenue. And it is really beneficial to the patients to not receive a bill, both from their treatment and from the people that are helping them pay for their treatment, right? So that means that our entire program is funded by the generosity of the community. And we are very appreciative of that. Everything that we do is based off of that generosity. And if anyone felt compelled to give money, if anyone felt compelled to help out, please contact us, contact our foundation here at GBMC, and find out what you can do to donate. Every penny counts, and I promise you, it goes to the patients and assists people in ways that a lot of people probably don't realize how crucial it is.
I would imagine too there are a lot of volunteer opportunities too to donate your time.
Certainly, we have a wonderful volunteer department here at GBMC. Our volunteers here at this hospital are incredible and do incredible things and come, every time they're scheduled, all the time. It's really impressive to me, and I think I want to give extra kudos to the volunteer department here and the folks that run at Carmen. But I would like to say also that yes, we do have volunteers and oncology support services that come and help us. We have volunteers in the boutique, or used to, and I hope to get back to that again. And so anyone who wants to donate time, we'd be interested to see what time wants to be donated. We also have, for current patients here, we have a patient family advisory council, which is a volunteer-based service, but folks serve for 2 years and help the cancer program make decisions that are based on how patients and their families would want those decisions to be made. So it helps give us a perspective that we may not have as people who work here and see this every day and maybe don't always understand what patients are really looking for. So if we want to, for instance, if we had a question about certain signage, would this sign make sense to you? And patients might say no. And to us, it made perfect sense. So it's really an important thing, and they work closely with Oncology Support Services, the PFAC does, Patient Family Advisory Council, and it's one of my favorite parts of my job is working with that group.
Here's a good question just came in. How do you promote this program to patients once they get there?
That's a great question, and thank you for asking. So first of all, everyone in the program knows that we exist and has become very adept at making referrals to us for a wide variety of problems. As you can see, the trigger for referral to us is as far-reaching from I don't know who's going to help my mother who lives with me while I'm in treatment because I'm normally her caregiver, to I need transportation, or I'm worried I can't afford this drug, or what do I tell my job? So the team is very good at making those referrals to us, but also when we have patients starting treatment, they come in and they meet with one of our oncology nurses to talk about what the side effects of that treatment are going to be, how often they're going to be here, and learn about those treatments. On the second half of that, my team comes in and explains our services, explains who we are and what we do, and we administer actually a quick survey we call it a distress screening tool, to assess where people are distress-wise and see if there's anything we can do right away to get started easing that distress. And frankly, sometimes just that conversation alone will back people off a little bit and help people relax. Once you get there, it's just a matter of continuing to ask the right questions and understanding what to do. So we also have brochures, and we have our website, but those are the main ways that we promote the program.
All right. Brandon, Costantino, thank you so much for joining us today and talking about the great work you guys are doing at Oncology Support Services. We appreciate it.
Absolutely. Thank you so much for having me. This is a blast.
And thank you for joining us.